In the shadow of America's darkest medical scandals, one man's unyielding conscience ignited a revolution in ethics. From 1932 to 1972, the U.S. Public Health Service conducted the infamous Tuskegee Syphilis Study, deceiving 399 black men in rural Alabama into believing they were receiving free health care. Instead, these sharecroppers, many poor and illiterate, were deliberately left untreated for syphilis, even after penicillin became the standard cure in the 1940s. Officials watched as the disease ravaged their bodies, causing blindness, insanity, and death, all in the name of science. By the end, at least 128 participants had died from syphilis or related complications, and the study infected wives and children unknowingly. It was a grotesque betrayal, rooted in racism and exploitation, that went unchallenged for decades, despite being documented in over a dozen medical journals. Peter Buxtun, a true unsung hero whose story pulses with quiet determination and moral fire. Born on September 29, 1937, in Prague, Czechoslovakia, to a Jewish Czech family, young Peter fled the Nazi occupation in 1939, arriving as a toddler on an Oregon farm. This early brush with tyranny, his family escaping the horrors of Hitler's regime, shaped his worldview. After earning a degree in European history from the University of Oregon and serving as a U.S. Army combat medic and psychiatric social worker, Buxtun joined the Public Health Service in December 1965. At 28, stationed in San Francisco, he interviewed venereal disease patients. But in mid-1966, casual chatter from colleagues unveiled the Tuskegee nightmare. Stunned, Buxtun later recalled, "I didn't want to believe it. This was the Public Health Service. We didn't do things like that." Drawing parallels to Nazi medical experiments on Jews and prisoners, a chilling echo of his family's past, he couldn't stay silent. What followed was a David versus Goliath battle few know about. In November 1966, Buxtun fired off a scathing protest to the CDC's Division of Venereal Diseases, demanding the men be treated ethically. Rejected outright, the study wasn't complete. He persisted. After leaving the service in 1967 to attend law school, graduating from UC Law San Francisco in 1971, he sent another blistering letter in November 1968, just months after Martin Luther King Jr.'s assassination, warning of the study's explosive racial implications. This prompted a secret blue ribbon panel in February 1969, where 17 experts debated but shockingly voted to continue, with one even suggesting photographing the dying men for posterity. Buxtun, undeterred by rebukes, including a heated confrontation with lead investigator Dr. John Cutler, consulted lawyers but found little support. Then, in a heart-pounding act of courage, Buxtun leaked documents in 1972 to Associated Press reporter Edith Lederer, who handed them to investigative journalist Jean Heller. On July 25, 1972, Heller's exposé exploded in the Washington Star, hitting the New York Times' front page the next day. The nation recoiled in horror. Senator Ted Kennedy demanded hearings. Buxtun testified boldly, and the study crumbled within months. A $10 million class action settlement followed for victims and heirs, birthing landmark federal regulations for human research ethics, including informed consent. Buxtun wasn't just a whistleblower, he was a beacon of humanity. In later years, as an antiques dealer reclaiming Nazi-stolen family properties and advocating personal freedoms, he spoke humbly at forums, often choking back tears. It wasn't moral strength, it was stupidity. Yet his stupidity saved lives and reformed medicine. For future generations, Peter Buxtun inspires us to question authority, champion the voiceless, and fight injustice no matter the cost. In an era of ethical gray areas, his story shouts, "One voice can shatter silence and heal a nation's wounds." What a thrilling reminder that heroes walk among us, quietly changing the world.